I'm Dr. Divyashree Rajendra. I'm a practicing orthodontist with my specialty clinic in orthodontics set up at HSR Layout, Bangalore. To state in one sentence, any retainer is better than no retainer. But again, when the patient has to choose or when I need to decide which retainer suits a patient, there are certain factors or certain criteria on which the particular retainer is given. Retainers again basically are of three kinds. There is a removable retainer with a wire and a plate, which is commonly known as Holly retainer. There is another plastic retainer made of clear plastic. So we call that as a clear retainer or an S6 retainer. And the third variety is a fixed wire retainer, which is glued onto the teeth from the inside. Now between the three, like I said, the factors which dictate which is better and which is not is as follows. For those patients who are very compliant with wearing the retainers, anything should be fine, even the removable ones. But for those who do not like to have a removable retainer, who do not like to take it out while eating, brushing and otherwise, and because of which they fail to wear the retainer completely, for them definitely a fixed retainer is better. The other advantages of a fixed retainer are that it is not visible because the retainer is a very thin wire which is glued onto the teeth from the inside, that is behind the teeth. So normally when you are speaking or smiling, the retainer is not visible. The second advantage with the fixed retainers is that you do not have to really take it out at all, and the patient in fact cannot take it out. So there is no question of taking it out before eating or brushing. These are the main advantages with the fixed retainer. But there are some disadvantages too. Since the wire is stuck on the front teeth, usually the front 6 or the front 8 teeth will have the fixed retainer. The patient cannot bite onto any food items from the front teeth, cannot eat an apple or a carrot or a snack bar because the retainer will break. If that happens and if it goes unnoticed, then the teeth which are loose, wherein the retainer is not sticking to the tooth anymore, is free to move. And if that happens, say the tooth moves out or gets rotated, then the patient will have to go through the orthodontic treatment once again. The second disadvantage of a fixed retainer is that since it is not visible, it is not easy to clean. And since there is the composite which we use to stick the retainer onto the teeth, food can get trapped around, and since the patient cannot see, cleaning also may not happen thoroughly. This could lead to implications like dental decay, bad smell, bleeding gums. So it is important that the patient maintains the hygiene thoroughly and make sure to get professional cleaning once in a while. Coming to the removable retainers, the two kinds I mentioned, one is the Holly's retainer which has a plate and a wire, and the other one is a clear plastic retainer. Both are good, both being removable. It is easy to take it out by the patient and brush the teeth well, so hygiene should not be an issue. Of course, since they are removable, it might not be comfortable to take off the retainers every time while eating or brushing. But on the other hand, the patient has the flexibility of wearing it most of the time and taking it out for some important events or functions, and the patient doesn't want to have the retainer on, they have the flexibility of taking it out. Of course, it needs to be cleaned, just like the patient has to clean his teeth, even the retainers need to be cleaned. So overall, like I said, more than which retainer is better than the other, it is important to have one or the other sort of retainer lifelong.